Hello guys and welcome back to my channel. Our today's topic is smoking. Smoking, it is a practice in which a substance is burned and the resulting smoke breath is to be tested and absorbed into the bloodstream. Most commonly the substance used is the dried leaves of the tobacco plant, which have been rolled into a small square of rice paper to create a small round cylinder called a cigarette. Smoking is primarily practiced as a route of administration for recreational drug use because the combustion of the dried plant leaves vaporizes and delivers active substances into the lungs, where these substances are rapidly absorbed by the lungs, and through the lungs by the pulmonary vein it reaches into the bloodstream and then to the bodily tissues. In the case of cigarette smoking, these substances are contained in a mixture of aerosol particles and gases and include the pharmacologically active alkaloid nicotine. The vaporization creates heated aerosol and gas into a form that allows inhalation and deep penetration into the lungs, where absorption into bloodstream of the active substances occur. In some cultures, smoking is also carried out as a part of various rituals where participants use it to help induce trance-like states that they believe can lead them to spiritual enlightenment. Smoking is one of the most common forms of recreational drug use. Tobacco smoking is the most popular form, being practiced by over 1 billion people globally, of whom the majority one is the developing countries. Common drugs for smoking include cannabis and opium. Some of the substances are classified as hard narcotics like heroin, but the use of these is very limited as they are usually not commercially available. Cigarettes are primarily industrially manufactured but also can be hand-rolled from loose tobacco and rolling paper. Other smoking implements, pipers, cigars, bidis, hookahs, and bongs. The history of the smoking cigarette. Smoking can be dated to as early as 500 BCE and has been recorded in many different cultures across the world. Early smoking evolved in association with religious ceremonies as offering to deities, in cleansing rituals, or to allow shamans and priests to alter their mind for purpose of divination or spiritual enlightenment. After the European exploration and conquest of the Americas, the practice of smoking tobacco quickly spread to the rest of the world. In regions like India and Sub-Saharan Africa, it merged with existing practices of smoking, mostly the use of cannabis. In the Europe, it introduced a new type of social activity and a form of drug intake which previously had been unknown. Now let's know what are the health effects of the smoking. Smoking is one of the leading causes of preventable death globally and is the cause of 15% of all deaths in the United States. About 500,000 deaths per year are attributed to smoking-related diseases. And a recent study estimated that as much as 1/3 of China's male population will be significantly shortened lifespans due to smoking. Male and female smokers lose an average of 13.2 and 14.5 years of life respectively. Among the diseases that can be caused by smoking are vascular stenosis, lung cancer, heart attacks, and the chronic obstructive pulmonary disease, that is the COPD. Smoking during pregnancy may also cause the ADSD to a fetus. Smoking is a risk factor strongly associated with periodontitis and tooth loss. The effects of smoking on periodontal tissues depend on the number of cigarettes smoked daily and the duration of the habit. People who smoke and drink alcohol heavily have much higher risk of developing oral cancer. Smoking can also cause melanosis in the mouth. Smoking has also been associated with oral conditions including dental caries, dental implant failures, pre-malignant lesions and cancers. It can alter the oral microbiota and can facilitate the colonization of the oral cavity with fungi and other pathogenic molds. Smoking is a risk factor for Alzheimer's disease. Smoking more than 15 cigarettes per day has been shown to worsen the symptoms of Crohn's disease. Smoking has been shown to actually lower the prevalence of ulcerative colitis. Smokers are 30 to 40% more likely to develop type 2 diabetes mellitus than non-smokers, and the increased risk with the number of cigarettes smoked. It also causes impotence, low birth weight of infants born by smoking mothers. 8% of long-term smokers develop the characteristic set of facial change known to doctors as smoker's face. Now let's know about the physiology of the smoking. Tobacco smoke is a complex mixture of over 5,000 identified chemicals, of which 98 are known to have specific physiological properties. The most important chemicals causing cancer are those that produce DNA damage, since such damage appears to be the primarily underlying cause of cancer. Inhaling the vaporized gas from substances into the lungs is a quick and very effective way of delivering drugs into the bloodstream, as the gas diffuses directly into the pulmonary vein, then into the heart, and then from there to the brain, and affects the user within less than a second of the first inhalation. Inhaling smoke into the lungs, no matter the substance, has adverse effects on one health. The incomplete combustion produced by burning plant material like tobacco or cannabis produces carbon monoxide, which impairs the ability of blood to carry oxygen when inhaled into the lungs. Now let's talk about the psychology. Most tobacco smokers begin during adolescence or childhood. Smoking has elements of risk-taking and rebellion, which often appeal to the young people. The presence of high-status models and peers may also encourage smoking, because teenagers are influenced more by their peers than by adults. Attempts by parents, schools, and health professionals at preventing people from trying cigarettes are not always successful. Smokers often repeat that cigarettes help relieve feelings of stress. However, the stress level of adult smokers are slightly higher than those of non-smokers. Adolescent smokers report increasing level of stress as they develop regular patterns of smoking, and smoking cessation leads to reduced stress. Far from acting as an aid for mood control, nicotine dependency seems to exacerbate stress. This is confirmed in the daily mood patterns described by smokers, with normal moods during smoking and worsening moods between the cigarettes. Thus, the apparent relaxing effect of smoking only reflects the reversal of the tension and irritability that develop during nicotine depletion. Dependent smokers need nicotine to remain feeling normal. Some preventive measures can be taken to reduce smoking. Education and counseling by physicians of children and adolescents has been found to be effective in decreasing the risk of tobacco use. Systematic reviews shows that the psychological intervention can help women stop smoking in the late pregnancy, reducing the low birth weight and preterm births. A 2012 Cochrane review showed that the combination of medication and behavioral support was more effective than minimal intervention or usual care. Another Cochrane review suggests that neither reducing smoking to quit nor quitting abruptly results in superior quit rates. People could therefore be given a choice of how to quit, and support provided to people who would specifically like to reduce their smoking before quitting.